Unlock the secrets, learn new tactics, and build a winning strategy to win the aging game. Welcome to the Aging Game with Bruce and Susan.
Welcome to the Aging Game podcast with Bruce and Susan. So today we have a special bonus episode for us. We are excited today to talk about a new Medicare pilot that's coming out, and we're going to have a doctor with us, Dr. Perry. So I'm super excited to bring this extra special episode. But before we get into that, let's catch up.
So what have you been up to?
I'm going to say I took it easy the last week. I went and did my favorite thing. It was Cars and Coffee last Sunday at Mercado, and I was at Rocco's Tacos there watching it, which is pretty much where you can find me any Sunday. But other than that, that was kind of it. Just trying to take a little bit of the summer to enjoy a little slower for me before season gets crazy. How about you?
Busy as ever. As what I do is I need to know what's going on with all the different communities. And so I've been visiting the different communities and checking them out and possibly meeting new staff out there and getting new rates and availability and checking up on all my partners out there. So it's kind of amazing, but there are 100 different senior living communities out there and try to stay current with all of them.
Wow, that's definitely a lot of work, and you're definitely staying busy this summer. So as we kind of dive into our topic of this, exciting pilot and talking about all of that, I know you've got a little story to kind of kick things off for us.
I do, thanks. And welcome, Dr. Perry. I was thinking about our topic, and which I think is going to be really important and something that people, should be very excited about. I got a call the other day, and it was a daughter up in Pittsburgh, and she had her parents live in assisted living, and she's like, Bruce, is there a resource that can come and check on my parents? Like, I just don't know what's going on. Is there an advocate? Is there somebody that can come and make sure things are right and the place is doing what they're supposed to be doing? And the listeners don't know, but I'm 6'7", so when I said, well, I'm happy to help. And so, when I walk into a place and being 6'7", Bruce is here. And so it definitely makes a difference. And so I just told her, you can definitely, you can reach out and use me as your advocate. And so I think, having a resource like that is very important for people, especially if you're not, if your loved one isn't near where you are.
I love it. I think that ties in exactly to what we're talking about today. And you know me, and I love statistics and numbers and different things like that. So as we kick off this topic today, I found two things that I thought were really interesting that I wanted to share before we dive into everything today. So in the US, more than 11 million informal caregivers, which is defined as an unpaid caregiver or family member, provide an estimated 15.3 billion hours of care to people with Alzheimer's or other dementias per year. I just thought that's
crazy.
Crazy numbers. 15.3 billion hours. Wow. And then, dementia is an extremely costly disease. In 2021, the total cost for caring for individuals with dementia in the U.S. was approximately $355 billion. And they projected by 2050 that this would go up to 1.1 trillion with a T. I think that's wild. So, with that, I just thought those were two things that jumped off, the page as we're going to dive into this and talk about, support and Alzheimer's and dementia. Those two things were just wild to me.
15.3 billion hours.
Yeah, of unpaid caregiving that family members are doing, things like that. And then I was further diving into it and kind of broke it down a little more about, most people that are in an informal caregiver role are still working like a full-time 40-hour-a-week job. And then they're averaging somewhere between, 25 and 35 hours a week of caregiving of a loved one. It was just wild numbers to me. So, there's a lot out there, and we see caregiver burnout. We see studies about the informal caregiver getting, sick and different things happening with them. And in some instances with the older population passing away before the person with the ailment. So really interesting things out there. And That's why I'm really excited to bring this bonus episode today and talk about this program and, the great things that it has, to help those with Alzheimer's and dementia.
Great stats. Very, very informative. You know, because the aging game is about, developing your strategy and developing your life plan, and trying to tie it into the game of chess. And I'm not sure if Bobby Fischer said this, but I do have a quote that, it's not a move, even the best move that you should seek, but a realizational plan. So I think it's important that you have a plan in place. Having a plan that's comprehensive, that's achievable, is probably the utmost importance.
Yeah, I think people think a lot there's that one move or that best thing they can do. But I think as we've kind of gone through a couple of these episodes and what we still got to come out, it's a multitude of moves that you're putting together to build that strategy and have a great plan that you can bring to life.
So true.
Yeah.
When experience matters the most, Senior Housing Solutions uses over 30 years of industry knowledge to provide expert advice for those considering a move to a senior living community. We are the matchmakers of senior housing. Call today at 239-595-0207 for your free consultation.
All right. Well, welcome to what we call the Gambit. So it's the main segment here where we dive into our topic. So today we have with us Dr. Adam Perry. He is a local geriatrician with us, and he's here to share this wonderful program that's launching July 1st.
Welcome, Dr. Perry. We are very excited to hear about this new pilot program. Thank you for being here today.
Glad to be here, and thanks for hitting on some of those important themes early. You mentioned trillion with a T, and we're talking about a new Medicare program. So I think we got a lot to talk about already.
Yeah, very exciting. So before we get started, I ask all of our guests the same question, which is, what is something that you know today that you wish you knew at an earlier time, maybe in your career or your personal life, that's kind of pertinent to the topic at hand?
That's a good question. I think there's three things as a physician that I wish I would have known. I've been a physician for 25 years, and early on in my career, I worked in the hospital and mostly in the emergency department. And I wish I would understand then sort of how the system works. And by the system, I mean how the plans we make as a medical team, discharge plans, medication plans, follow-up plans, and the support that's available in the community, functional support, transportation, meals, assistance in the home, oftentimes aren't coordinated, and that can lead to some real challenges for patients or people and families. And so the second thing that I wish I knew is that the policy and the payment are why those systems aren't connected. It's no one's fault. Everyone's doing exactly the best that they can. But understanding the policy and the payments is what this new program is about, and really changing the policy and the payment. And it's sort of revolutionary in that regard. And then the third thing, just as a young doctor in the emergency department and in the hospital, I wish I would have understood really how much dementia is there. There's the group of people who have dementia and they have a diagnosis and they may have a more moderately severe stage. And then there's a large group of people who have dementia that affects their daily function and their medical program and their functioning in their home and with their family. And the hospital and the emergency department are just geared to look for that. And oftentimes, as we know, you don't see what you're not looking for. So,
interesting. Well, welcome. Before we start getting into all this, can you just kind of back up a little bit and tell us a little bit more about who you are, more about your career? Where'd you study? Where'd you practice? I know you touched on it a little bit, but can you just tell us a little bit more about you?
Sure. Yeah. You mentioned Pittsburgh earlier, so I'm from Pennsylvania. I'm from Scranton, which is famous for a few reasons. Then went to med school at Pitt. In the first several years of my career, I worked in emergency medicine in small hospitals, rural hospitals. It used to be called a critical access hospital. And then I worked in larger hospitals and sort of ended up in Philadelphia and Scranton. And what I really realized, this is, say, 20 years ago, 15 years ago, is that increasingly we were taking care of older adults with really complicated needs in the emergency department. And sometimes they landed there for a medical, real challenge, a stroke, a bleed. But oftentimes it was more an exacerbation of a chronic problem, or it was a caregiving challenge in the setting of all the other issues. And so I started to really focus my career and my training at that point on taking care of older adults with really complicated or more complicated care needs. And that's largely a population with dementia. So
Great.
I currently work in home-based care models, both primary care with a group in Virginia, and then the hospital at home model, which is a new model. And I work with teams in several states designing these programs. And then I also do some advocacy and education work.
What brought you to Southwest Florida?
Naples,
Paradise.
Collier County, Lee County.
Okay.
That's a great question, Bruce. We have, believe it or not, I've got 3 young kids, 6, 4, and 2. And my wife and I said, nothing wrong with Scranton, but let's go down to Naples.
Nice.
We, like everyone else, we think it's the greatest place.
Yeah, it is paradise. You have a ton of amazing experience. What was it specifically that got you really passionate about this, portion of the population being the seniors?
And it was really that time working with patients and family during critical points in their lives, really in the emergency department and hospital, and thinking, what else could we do other than saying, well, I don't think you're having a stroke, or I think you may have had a stroke, and we'll put you in the hospital. And it was really recognizing that the limits of our capacity, both diagnostically, but also from a care plan perspective, and the need to design a program that was more sort of comprehensive. And at that point is when I decided to focus on people with complex care needs. And like many of us, I've also been a caregiver, had the privilege of being a caregiver with my siblings for parents. So I'm glad to have the opportunity to continue to work with this group.
Great. So let's talk more about the pilot program. It's called the Guide Program.
Yep.
And so can you tell us, sort of give us an overview of what the Guide Program is?
Yeah, the Guide Program stands for Guiding an Improved Dementia Experience. And it is a new program to start in July from the Medicare or CMS Innovation Unit. And this unit designs programs with specific goals. And so the 3 goals of this program are to improve quality of life for people living with dementia. And that's a pretty broad definition. Quality of life, both medical and functional, cognitive. And really uniquely, to improve quality of life or reduce strain or burden for caregivers. And then lastly, because it is Medicare, to limit or at least not increase the costs above what they would have otherwise. So it's a unique program in that it's both a care program, increased resources for people with dementia and their caregivers, but it's a research program in that they're going to track sort of cost hospitalizations and such over time and see which interventions help people and their caregivers.
I mean, this just sounds like a wonderful program, and I think it's exciting to see that Medicare has finally recognized, this part of the aging population and what they need. So for our listeners, what should they know about what would make someone eligible or, this an option for them?
Yeah, so there's 3, I would say, eligibility criteria right off the bat. The first is a diagnosis of dementia or a suspicion of dementia by a provider who is, say, dementia proficient, a geriatrician, a neurologist, a psychiatrist, a provider who works in long-term care, assisted living. And Medicare is very aware that a large proportion of the population with dementia doesn't have a formal diagnosis. So they're encouraging providers with dementia proficiency to enroll people with a diagnosis of dementia or a clinical suspicion with a pathway to diagnose people formally in the first months or so. The second is this is a Medicare A and B program. So this is what we call fee-for-service or traditional Medicare. People who have Medicare Advantage or a PACE program or enrolled in hospice have a lot of these benefits, sort of in their insurance package already. So it's the third is the caregiver, and I should define what I mean by that. It's to Medicare, a caregiver is an unpaid family or friend who helps with self-care, bathing, dressing, that sort of thing, or what we call IADLs, transportation, medication management, house cleaning, that sort of thing. So it's a large group of people who are going to be eligible to participate.
It's really interesting. I see, a lot in my specific industry is where, having clients come to admitted services. I'll have families say to me, "Oh, mom has Alzheimer's or mom has dementia," and I'll ask them always back, "Well, when was that diagnosed?" Well, it wasn't. And then they'll say, "Oh, it's age-related forgetfulness or different things like that." So I do think that there's definitely a huge population out there that fall into that suspected category. And there's definitely like a pathway for them to, engage with this program.
That's been one of the real eye openers in, say, the last couple of years looking at Medicare policy is they've looked at those numbers, the $1 trillion or so, and said people that have dementia or suspected dementia, undiagnosed dementia, the inpatient spend and rehab spend is about 3 times more that was someone that has the same medical co-occurring conditions, heart failure, diabetes. And oftentimes it's because the dementia isn't recognized and the care plan therefore isn't appropriate and comprehensive. And so Medicare is really encouraging, providers to recognize and diagnose people and get them the type of care that they're now going to be able to get.
Fantastic. You mentioned an acronym, and we're trying to, for the listeners, kind of spell that out for everybody. What it was?
ADL, or Activities of Daily Living. I think we call that self-care needs, and the best way I've heard it described is sort of the things that you do in the first half hour of your day. You get out of bed, you put your clothes on, you take care of your hygiene needs, maybe you'll eat breakfast. And then the IADL, instrumental activity of daily living, is those things that maybe you do around the house in the first several hours of your day. Make a meal, go shopping, drive yourself to a doctor's appointment. Those things that you really need to live independently over time. Whereas the activities of daily living are those things that you need to live independently really for any period of time.
Great. And I know we touched on this earlier, but maybe you can sort of expand that. If someone doesn't have a diagnosis of dementia, are they still eligible, and how would someone go down that path?
That's a great question. They are eligible, and the attestation to Medicare is from a provider, what they call a dementia proficient provider. So that is a geriatrician or a neurologist, a psychiatrist, or a provider who works in a setting where they see lots of older adults with dementia. And if that provider has a clinical suspicion that the person has dementia, they can be enrolled just like anyone who has a formal, what we call an ICD-10 diagnosis. And then during the course of the comprehensive evaluation, the team led by the dementia proficient provider would then diagnose the dementia. And enrollment won't be held up for people. And Medicare is very explicit that they want to get people enrolled who can benefit.
That's amazing. Being down here in Southwest Florida, we have a huge seasonal population. So how would the program work for those people that might be, transitioning back and forth between like here and up north?
We have such a unique perspective on this program here in our wonderful corner of Florida. And I think that this guide program is uniquely valuable for our seasonal residents with dementia and their caregivers or care partners. And that, let's say they're from Pittsburgh, and they may be well plugged in with a system up there, both a medical system and, really importantly, a community-based service and support system, day program, transportation, personal care. If they're not here much or aren't as entrenched in the community, they may really benefit more from the community-based service and supports, the care coordination, the transitional care management. So a person with dementia can only participate in one program. But I think there's a real value to considering and doing it here or at home. There's just got to be sort of knowledge on both ends of that, of the community supports.
It's fantastic. Can you talk a little bit more about which services and the benefits of those services that are available?
Yeah, the services really, what we call the care model or the care delivery elements, descend from those 3 goals: improve quality of life for people with dementia, relieve caregiver support or relieve caregiver stress or strain, and then have a neutral or positive effect on costs. And costs, they mean hospitalization and long-term nursing home placement. So within the bucket of improved quality of life, the care delivery elements are just expanding the perspective, say from just a medical perspective, treating diabetes, treating hypertension, to a real comprehensive assessment that is not only medical and medications, but cognitive, behavioral, functional, and using this really holistic assessment to make a care plan that gets the support, instead of being discharged from the hospital and saying, follow up with your doctor in a week or two. It's recognizing that the person needs support, the caregiver needs support, and saying, we'll help you get that follow-up. We'll make sure that the records get there, and we'll get you some, Instacart or whatever to get your meals, and we'll help you to maybe a day program if it's needed. So that's sort of the part of the quality of life is coordination of care. Another part really is transitions of care. We know with people with dementia, people with complicated medical challenges, information gets lost in the transfer from a hospital to a facility or even between doctors. And so the transitions of care element's a big part of that. The second bucket is really what's revolutionary about this program, and that's the caregiver support. And so it's both education and skills. People who care for a loved one with dementia oftentimes feel that they don't have the knowledge. This isn't something that we all learned growing up, so to speak. And so dealing with distressed behaviors or accessing the right community resources or benefits, managing medications, recognizing when someone might be ill, because it may look a little different when someone develops a moderate to severe dementia. So it's education and training. But really, really interestingly is this respite component. And that's where Medicare for the first time has said, we're going to pay for non-medical care in the home, what would be called maybe personal care in the home, because Medicare realizes that caregivers oftentimes suffer both, medically and from a emotional perspective, and having to choose between caring for their loved one and getting the care maybe they need. And the last bucket, the sort of Medicare cost perspective, is really focused on helping to limit or avoid potentially avoidable hospitalizations, and a big focus on harm reduction and medications. We all know that people with dementia can react differently to different medications, sedatives, anticholinergics, antihistamines, those sorts of things. So helping to make sure that people are on medication regimens that are most likely to benefit and also reduce harm without benefit.
I mean, the benefits of the program seem very comprehensive and well-rounded. I especially love, you had touched on it a little there, the respite. So I want to dive into that just a little for our listeners. Respite might be kind of a foreign word to them. What is really that benefit, and what does that look like for them?
Yeah, this is a really unique benefit, and it's open to people with dementia in the program who have identified a caregiver, and we talked about a caregiver as an unpaid family member or friend. So the caregiver, part of the caregiver benefit is respite, and that is three forms, the most common of which we think will be the ability for the caregiver or care partner to have a skilled, certified personal care aide, CNA, come into the home and provide up to 83 hours a year of personal care while the caregiver does what they need to do. And so that's 7 hours a month or so. And that's brand new. Medicare has never ventured into paying for personal care in the home. They also will pay for something like an adult day program if the patient or family wants to do that. And they will pay for care in a facility as respite as well if the care provider or caregiver goes on vacation or needs medical care. So there's three types: in the home, day program, and overnight. But it's about 83 hours a year.
And these hours, are they flexible, or are they they can kind of use them as they wish?
It's really interesting that you mentioned that, because they're flexible and certainly used as the caregiver needs them. And then the big focus of respite is to help reduce caregiver burden or strain, which the program is going to measure through a couple of different questionnaires. So it's a new benefit. It's very forward thinking and quite generous to help reduce caregiver stress, if you would.
Yeah, I love it. I think it's fabulous.
So when I think about respite, I think about it's a short-term type of arrangement. So if somebody needs this on a longer term basis, how does this work?
Yeah, the respite benefit with a guide is this, annual cap. And we think that people may learn how best to use it for themselves and use the entire cap in the annual 2024 and then 2025. It's an 8-year program, by the way, if I hadn't mentioned that before. So this respite benefit will be available through 2032. But certainly if the family uses all of the respite benefit and wants to continue with the provider, then it would be something that's sort of self-pay. Caregivers certainly can design a program to use that as they need, either in the home overnights or in the home on a more as-needed basis. Interestingly, this program also extends to people who live in assisted living. And there's a few different ways that assisted living can be supported in the care that they need for their residents that have dementia.
So if somebody's in assisted living or memory care and they just need an hour here, an hour there, that would work out extremely well, because that's not deducting a big part of that 83 hours.
It's remarkable the degree to which Medicare is letting the local programs be flexible with this benefit, as long as the beneficiaries are getting the care that they're entitled to. And it also helps support some of the challenges. We're all familiar with the workforce challenges in senior living these days. And there are also Medicare, there's also a Medicare emphasis on workforce expansion. And this is a reinforcing pillar.
There's so many wonderful aspects to this. I know that our listeners have to be, have that burning question of, how is this paid for, or what, how does that impact them, or is there a copay? So can we dive into that a little?
That's a great question. I probably should have led with that. These innovation center programs, this is a no-cost program. It's an entitlement for Medicare beneficiaries who qualify, and there are no costs associated with copays. There's no cost for the respite up to the cap, the 83 hours or so of in-home care. So it's unique in that way, and it doesn't affect their ability to get care anywhere. They keep their own primary care doc and specialists and hospitalizations and skilled stays. None of it's affected. It's really meant to be like an extra level of support and coordination.
So, I'm just going to kind of dig a little bit further. So, if somebody's in assisted living or memory care, and there are multiple people under this program, for example, the folks Brightstar can come and provide assistance for multiple people at the same time.
That is one of the flexibilities, would be to have multiple beneficiaries receive the respite in an efficient way. Again, it's been an impressive degree of flexibility with regard to figuring that out. And operationally, that might be, obviously a different lift than having houses that are separated and getting care to the house. But it's really interesting. As many programs there's going to be around the country, I don't know if anyone knows how many there are going to be yet, but as many programs as there's going to be a lot of different ways to supply the same benefits. And that's what Medicare is trying to do. They're trying to learn what works best.
Wow. I mean, I love that there's that flexibility with that respite, because if you really are going to give someone that break or that respite, you do have to be flexible, and everyone's situations are different.
Yeah, that's for sure. And one of the interesting things to think about here is, we've got the case of the home, and in the case of the assisted living, there's also the independent living group who will have maybe another way that's most desirable for them and their families. And as we talk about assisted and independent, there's a point I think is important, is that in the eligibility, you've got to have Medicare A and B, but you also can't be in a nursing home as defined by Medicare. And that means in long-term nursing care, say in a facility that does skilled nursing, Part A, on, say, a Medicaid waiver program. So that's another sort of caveat.
Good to know.
Yeah, real good to know.
being that this is a pilot program, and you mentioned that earlier that it's an 8-year program, what is Medicare looking to accomplish with this program?
Medicare is looking to solve sort of the challenge that Susan started with is we know that costs due to dementia are high and rising quickly as the population ages, and a lot of the costs are those associated directly to both diagnosed and undiagnosed dementia, which are much higher for people with dementia than without. And so the thinking, and it's based on other studies that have been done and other really robust programs that are similar to this, is that if you can add that extra level of support and coordination for patients and their caregivers, you can improve quality of life while decreasing or at least holding costs neutral. So the reason that it's such a long program, and these innovation programs are usually much shorter, is that we know that many or most forms of dementia are sort of insidious in onset. And if you want to see an effect over time, you need a longer period of time. 3 years, you might not see a big effect on nursing home placement, say. And so that's why they've made it 8 years.
So if someone is interested in learning about the program or learning if they're eligible, how can we direct them, or where should we direct them to?
That's because it's brand new. So as we get closer to that time, they'll start to announce where the programs are and put out some information on their website. CMS or CMMI would be the website to check. But in that it's a new model and a new program, certainly it's something that I follow and we follow, so we'll be able to direct people when it comes in July as to where local programs may be. There will be local programs, we think, in someone who just works in, whatever, say, just Orlando, say. And there'll be programs that try to be over a larger swath and then provide respite over a large period or a large area. So I guess the best answer to that is stay tuned, and we'll be able to tell you in about 7 weeks or so.
So our episode is airing July 30th.
Oh.
So can we re-ask it?
Yeah, sorry about that. Yeah,
and
please.
Ben, you'll cut all this out
Sorry,
too.
Ben. I didn't know that. That's
Sorry,
a huge
Ben.
deal. All right. Yeah, so that's cool. So want me to are we
Just how they can learn about the program.
okay.
Just
And-
don't say that it is coming in the future.
Gotcha.
It already came 4 weeks ago.
Oh, it's going great. It's going so
Yeah,
great.
it's so great.
Um,
That'll be your next question, by the way. How's it going?
So I guess what I'll say there,
Just direction to that website.
yeah, the website's going to be HS Healthspan swfl.org or .com, yeah, or call Brett. So, yep,
Yeah,
I got an
you
answer.
do
Yep,
you.
yep.
All right. So if someone's interested in learning about the program or if they're eligible, where can you direct them to get more information?
Sure. So general information, you can go on the CMS or Center for Medicare and Medicaid Services website. Certainly here for us in Southwest Florida, you can go to our program at healthspan, swfl.com. That's healthspan, one word, swfl.com, and sign up for eligibility and initial conversation.
So I'm just curious, how's it going? How's the response been?
Really robust, as we sort of expected, and as Medicare expected. There's a huge need from a provider perspective, and from a patient perspective, and from a caregiver perspective for coordination and increased support for everyone. And it's been going very well, and look forward to growing the program and really getting this benefit to so many people who are likely to benefit here in Southwest Florida.
I think it's important. The more people that participate will help get the positive outcomes, I think, that we're looking to accomplish, not just here, but nationwide.
For sure, yeah. And because it's a new program, we know that it'll evolve over time, not the care delivery elements, but some of those operational elements about how best to get the benefit or entitlement to people who can need it. And it is a challenging group and a new group to try to reach through some of the means that other programs may use. So I think everyone's on the learning curve, But Medicare is really, really invested in getting this type of support to families as quickly as possible.
I mean, I'm very excited. I was very excited when we talked months and months ago about this program and just kind of learning about it then. One of the things that I see a lot in working with my clients is sometimes they're hesitant to services, or sometimes they've had a challenging experience or somewhere. And with Medicare, we do encounter that there are challenges in other arenas of it. So if, one of our listeners is out there and they're, it's piquing their interest, but maybe they're hesitant for one reason or another, what's some advice you might want to share with them?
I'd say that this program is designed explicitly to be easy to use, both enroll and then get the support. It is, as I mentioned, a no copay program and totally no cost program. And it's not a medicalized program that relies on leaving the home and seeing a provider and finding the right diagnosis code and having timed visits with providers. This is really largely a care coordination and case management program. Often it's directed towards the caregiver as they need it and as they use it. There are online resources that are really modern, if you would, and exceedingly helpful in small chunks of time. So it's designed, and we've designed it really to be exceedingly user-friendly, very relevant, respect everyone's time, and work around your schedule, and no cost.
I love it. I know that we mentioned a little that, obviously there's the local group here that you're, hosting for this. And we know there's going to be other providers that are kind of covering the whole state. But Bruce and I are always big advocates of, when you're exploring something, choosing local. And I think since this has such a component of connecting you with resources and that respite care, we definitely want to encourage our listeners to choose that local provider versus maybe more of a regional one who might not have as much knowledge of your area to really get that, quality outcome.
It's a great point. And caring for people with dementia and their caregivers is often a physical endeavor, be it in the home or taking care of IADLs, helping clean around the house or make sure medications are delivered. And so that knowledge of the local medical and community support infrastructure is really, really critical. And then, of course, the respite component. Each area has its own unique personal care infrastructure. And the closer you are to the area, I think the more reliable that is.
I'm very excited about this program. It's about time. And Dr. Perry, it's great having you here today. And I'm sure, knowing what I know about the government and everything, trying to get, this approved through Medicare probably has probably been a very difficult process. And so, bless you for doing this. And, I can't wait to, have you back in the future to really kind of dig deeper into how things are going, how, what the response has been. So, let's stay tuned for that. So, but thank you very much for being here.
I appreciate the opportunity to talk to you and to hopefully get the word out to both people living with dementia and their families and caregivers about a new program that's designed to help.
I think it's going to be wonderful. Thank you so much for taking the time to be with us. We truly appreciate it, and I know our listeners do too.
Before we go, is there anything else you want to share that we haven't asked?
No, that's it. I look forward to continuing to work with you guys and provide the care that's long past due.
Bright Star Care of Naples and Fort Myers, providing exceptional in-home care. At Bright Star Care of Naples and Fort Myers, we believe that you and your loved ones deserve nothing but the best. Our team of highly trained nurses and caregivers are committed to delivering the highest standard of in-home care. We offer a wide range of both medical and non-medical services to cater to your specific needs. From companion care and personal care to skilled nursing and therapy services, our professional care team is here to meet your needs, both now and in the future. Bright Star Care is proud to provide the highest quality of care and prioritize in-home safety. We are accredited by the Joint Commission, and all care is overseen by a registered nurse. With Bright Star Care, you can have peace of mind knowing that your loved one is in the best hands. To learn more about Bright Star Care of Naples and Fort Myers, visit us online at brightstarcare.com or give us a call at 239-992-4779. We are available 24/7 to answer any questions you may have. Bright Star Care of Naples and Fort Myers, where exceptional care meets compassion. Locally owned and operated since 2006.
All right, well, welcome to Checkmate, which is our, segment where we're going to kind of wrap up the episode today. So, Bruce, if there was kind of one thing you had as a takeaway from this that you think our listeners should just, that one thing, what is it for you?
Well, I would say, this program is an exciting program that, is going to help so many people and, caregivers. And, it's just such a breath of fresh air that we're now have this program that Medicare is now stepping up to provide this for people. So, I'm very excited that, there's something like this available for people.
Really is exciting.
So, Susan, I know you're big on your activities of the week. So what's going on this week in the community?
I do love to keep us informed. So we've got some exciting things coming up. So celebrating Imagination exhibit is at the Marco Island Center for the Arts, and it's now through the end of the month. This Saturday and Sunday is Southwest Florida's biggest indoor arts and crafts show. It is up in Punta Gorda, but it is always totally worth the drive. I know it's a little far, but it's 10 to 3, and it's everything you can imagine. They have such wonderful things there. And then this Sunday is also the Celebration Church at Cambria Park at 9:30 in downtown Naples. And then tomorrow is probably my most favorite event of what's coming up. So Bruce here will be a panelist at the Senior Symposium at NABOR, and it's presented by the Women's Council of Realtors. And I know it's tomorrow, but I'm still hoping we can squeeze in an extra RSVP. So if you are interested and you want to go see Bruce live in action, you can RSVP by calling 239-597-1666.
Come see me. I'll be there. It's going to be a great event. A lot of people have RSVP'd so far. So definitely, get on your phone and call them right away. So sounds like a great week, and can't wait to revisit and talk more about our topics for next week.
Yeah, I'm very excited about everything that we have coming up. I'm excited to see you at the symposium tomorrow. So hopefully they'll come out and meet, the Aging Game duo.
And if people want to learn more about this program, they can go to our website called theaginggamepodcast.com. So it's theaginggamepodcast.com. And so we'll have resources available on our website.
I love it. Well, next week we have a great episode. I'm super excited about that. We are going to be talking about all things resources here in Southwest Florida, and we will be featuring our guest, Amanda Barton, with the Seniors Blue Book.
See you then.
See you then.
Be sure to subscribe to our podcast and follow us on social media. You can also find more information and resources at www.theaginggamepodcast.com.